Yogurt prepared with Streptococcus salivarius strain BIO5 for control of oral microbiota prevention and treatment of bacterial tonsillitis. This is a presentation prepared by Dr. Vera Fantinato. Dr. Fantinato would like to thank the organizer of the Probiotics Conference 2023, especially Dr. Nova Stevenson, manager of Probiotics Conference. She feels honored to be invited as a speaker. Let's take care of our children. Let's go. Some questions. Do you know what is the most common disease in childhood? Do you know how to treat it? Do you know the consequences? Do you know how to prevent it? Answer to the first question. The problem is tonsillitis. In children all over the world, sore throat is one of the most common diseases, and the infection by GAS is the main concern. Answer to the second question. The treatment is antibiotics with penicillin. The answer to the third question. Recurrent tonsillitis brings rheumatic fever, is the main reason for acquired heart diseases worldwide. The most serious consequences of recurrent tonsillitis is the rheumatic fever, which is the main reason for acquired heart diseases worldwide. The current reality in Brazil, 10 million cases of bacterial tonsillitis per year. 3,000 develop rheumatic fever. 50% of 3,000 have severe heart damage. $250 million per year is the estimate for the treatment. No treatment for rheumatic fever is definitive. The answer to the first question, prevention, it doesn't exist, or better, it did not exist. And what has science done about treatments? Searching for more antibiotics. Yes, can you believe it? Penicillin's resistance has reached more than 60% in Scandinavia. For many years, treatment failure with penicillin has been discussed if it's clinically efficient eliminating GAS from the throat. Streptococcus salivarius, the main tongue bacteria, lives in the tongue. Streptococcus salivarius is a dominant oral species and the best suitable candidate for probiotic of oral cavity. Since Streptococcus salivarius is able to produce bacteriocins against Streptococcus pyogenes, interest has been focused on the use of it as a probiotic to avoid sore throats by Streptococcus pyogenes. And no, has no toxicity factor. All newborns 2 hours after being born start to be colonized with Streptococcus salivarius, the good bacteria, and remain so for their entire life. So, what do we have to offer? What is the innovation? A yogurt prepared with a good bacteria that inhibits the growth of the bad bacteria, which causes tonsillitis. Good bacteria, Streptococcus salivarius produces bacteriocins, which kills the bad bacteria, Streptococcus pyogenes, the agent of tonsillitis. Results. Formulation of yogurt with 3 good bacteria. Tests with 90 children to choose the best bacteria able to colonize mouth. Taking the yogurt for 30 days, 3 times a week. This is a group of children that use the yogurt to select the best strains for colonization of the oral cavity. To choose among the 3 strains, the one that best colonized the oral cavity of the children. Selected the strain which colonized the mouth of the tested children. We called it Streptococcus salivarius BIO5. So, this study was carried out to verify whether the use of yogurt prepared with the strain of the probiotics Streptococcus salivarius BIO5 could interfere in any way in the normal oral microbiota of students. We collected saliva twice before the use of yogurt, and each 50 days after beginning the use of yogurt, to have an average of bacteria's number before and after the use of yogurt. 60 healthy students aged between 4 and 14 years were selected. They took the yogurt 3 times a week for a period of 90 days. Students' saliva was collected to check for presence and qualification of the microorganisms. Selected the strain which colonized better the mouth of the tested children. We called it Streptococcus salivarius BIO5. Bacteriocin positive tests. We selected one strain with high capacity to inhibit 133 different strains of Streptococcus pyogenes, the agent of tonsillitis. The sample was also tested for adhesion to KB cells presenting high adhesion capacity. Other tests showed total absence of toxicity. This strain was called Streptococcus salivarius BIO5. The Streptococcus salivarius BIO5 was isolated from the tongue of the healthy young woman who never had sore throat. The Streptococcus salivarius BIO5 strain was isolated from healthy individual who never had tonsillitis, and its identification was carried out by PCR tests. New experiment. Evaluation effect of yogurt prepared with BIO5 on the oral microbiota of healthy children. Tests with 90 healthy children. Yogurt for 90 days, 3 times a week. These are the microorganisms we test. Staphylococci, total streptococci, mutants streptococci, lactobacilli, pseudomonas, enterobacteria, yeasts, anaerobic. Results. 71 presented a decrease of enterobacteriaceae, 95% decrease of yeast, 66% decrease of pseudomonas, 63% decrease of Staphylococcus, 59% decrease of lactobacilli, 90% decrease of anaerobics, 78% decrease of mutant groups. In short, we can conclude that after routine use of yogurt, the results show that after 90 days of using yogurt, there was a decrease in microorganisms that are not part of resident oral microbiota, and there was no change in microorganisms considered to be residents. Decrease in the transient bacteria studied, which was statistically evidenced, is already a benefit in itself, as it keeps the equilibrium of the microbiota because the introduction of the probiotics residing in the habitat adjusts and reproduces without causing any damages to the resident microbiota because it is an important part of the normal oral microbiota. For the colonization of the probiotic under the study, the results showed that average percentage of colonization of the BIO5 strain in relation to the total number of oral streptococci was 41%, which we can consider an excellent level, indicating positive colonization during the use of yogurt. If it were only for this reason, using yogurt regularly with the BIO5 strain, we would already have the benefit of cleaning the mouth by reducing opportunistic microorganisms that are present in all individuals, but mainly in greater quantity in children. Oral microbiota equilibrium. Our proposal is to allow a suitable ecological equilibrium in the oral cavity by using yogurt, prepared with the strain of probiotics Streptococcus salivarius BIO5. Clean mouth. We can see the same in children and adults. But we have more than that. Let's take a look at the next essays. Based on the positive results we tested efficiently, the yogurt prepared with BIO5 in the treatment of children with recurrent tonsillitis. The pediatricians followed up the children for 1 year during the entire study with a monthly clinical assessment. 140 children with recurrent tonsillitis, aged 2 to 14 years old, yogurt daily for 1 year. Children with recurrent tonsillitis were selected from 3 different health centers. A total of 140 children aged 2 to 40 years old screened for recurrent tonsillitis caused by Streptococcus pyogenes. To evaluate the potential of 1 year daily consumption of yogurt with the BIO5 probiotic in controlling tonsillitis caused by Streptococcus pyogenes, a double-blinded study was performed. The results. Health Center 1, 90% of the children have no recurrence of tonsillitis. Health Center 2, 79% of the children have no recurrence of tonsillitis. Health Center 3, 92% of the children have no recurrence of tonsillitis. Health Center 1 plus 2 plus 3 results in 89% absence of tonsillitis recurrence. Combining all the results of 3 health centers showed that there was a consistently high cure rate, with 89% of the total of children without sore throats. Just 11% experienced recurrence of tonsillitis, and all of them had other respiratory tract complications. In contrast, children on placebo yogurt experienced almost 90% recurrence of tonsillitis. In contrast, the children who dropped out of the project experienced a rate of tonsillitis recurrence about 6 times higher. Objective: prevention. World Health Organization, World Trend. A yogurt is already a worldwide food accepted both by adults and mainly by children. We see this food as a great potential to prevent bacterial tonsillitis and to keep microbiota equilibrium and oral health. True routine consumption of the yogurt, being the Streptococcus salivarius species, a typical inhabitant of the tongue, it would easily colonize this environment and would make it difficult for pathogenic transient microorganisms to invade the site, preventing the development of infectious disease. Only prevent? No, no, no. It needs to be tasty. Can be used by everyone. Can be used by people of any age without side effects. Restores health without removing the tonsils. Rebalance the ecological relationship of the oral environment. Pediatricians, nutritionists, mothers, and children also approve it for being a great food and its delicious taste and flavors proposed by the market. These yogurts combine the benefits of oral microbiota equilibrium and consequent protection of its habitat against invasion of Streptococcus pyogenes. Routine consumption of yogurt with the new probiotics Streptococcus salivarius BIO5 demonstrated it can contribute to a better oral health for its help to decrease transient and potentially pathogenic microorganisms in this environment. Thinking about considering the bacterial tonsillitis is the childhood disease of the highest incidence in children worldwide, controlled measures are required. It is important to remember that recurrent throat infections in childhood cause severe sequels, such as rheumatic fever and acute glomerulonephritis. In conclusion, food enriched with microbes capable of combating infection is a much better option. The use of yogurt rich in BIO5 Streptococcus salivarius probiotic for combating recurrent tonsillitis is one example of such an approach. Imagine children all over the world drinking yogurt instead of injections of benzetacil to treat a sore throat. What is the biggest difficulty in introducing this yogurt to the market? The major difficulty of introducing yogurt with probiotics to the market for prevention and cure of bacterial tonsillitis is that international legislation on probiotics prohibits the information that they can prevent or cure disease. But if the results of scientific research now show this to be a real possibility, the legislation need to be updated. We would be avoiding the use of antibiotics and after effects of repeated tonsillitis, such as heart surgery, which does not always give the desired results. If we look at the advances that digital technology has brought to the world, we should also look at how many hundreds of laws have been created due to this advance. With human health, especially of the children, wouldn't these laws be even more important, these new laws? After all, we are dealing with lives, not just machines. Let's do all the safety testing, but we have to break this new ground for probiotics. The World Health Organization considers rheumatic fever prevention a priority, but what have we observed? That this disease continues to exist because of the lack of control in the use of antibiotics, or because many children do not have access to them, or because there is a large amount of abandonment of the treatment. Children do not have access to it, or because there is a large amount of abandonment of antibiotic treatment, or even because of the difficulty making free healthcare. The yogurt presented here, as shown, cures bacterial tonsillitis, caused by Streptococcus pyogenes. It would, therefore, be a nice way for children to be cured. We have created a way for the child to desire the treatment and not run away from it, from fear of painful penicillin injections. The international law, food products with probiotics cannot contain information on the label that it prevents or cures diseases. How so? So let's take the probiotic food to the pharmaceutical industry. The pharmaceutical industry cannot sell food. So we develop a yogurt that prevents and cures tonsillitis, and we cannot use. Children and adults too are not allowed to buy it because the law doesn't permit. It is logical to think what is necessary to change the law. Everybody buys yogurt. It is something that is already part of people's diet. It is there in the refrigerator. It is good for the children and adults. It is good for the industry too, because people will buy this yogurt routinely. Yogurt presents 80% of refrigerated foods. Children love it. They really love it. They really like it. And who doesn't? And why this? If we have this one, and for probiotics, the sky's the limit. The children, thank you. That's what we had for today. Thank you for your attention. Have an excellent meeting, Dr. Vera Fantinato.